Inflammation is part of our body's immune response. Without inflammation, then the body will be unable to heal. Arthritis is mainly an acidic condition related to the inflammation and pain that typifies this disease. The most common form is osteoarthritis. This comes from a slow degeneration of cartilage, which is the cushion tissue that lines the joints. Joints mainly affected by arthritis are the knee, hips, fingers, and the vertebrae of the spine. This type of illness is often confused with osteoporosis, which is another serious health issue that affects the bones. Osteoporosis is when your bones become fragile and brittle, losing minerals such as calcium faster than the body can replace them. This leads to low bone density and high risk of fractures. To treat this type of illness would be entirely different to treating rheumatoid arthritis. With rheumatoid arthritis, there is some genetic tendency. Nevertheless, there are things you can do to delay the onset and minimize the symptoms of this disease. The first and most important step is decreasing acid-forming food. After changing your diet, exercise might be the last thing you think of or feel like doing. But physical activity improves flexibility, posture and balance, builds muscle, boosts bone density, eases joint pain and stiffness. Aim to exercise just moderate. Remember to take it slow and slowly build up your strength. When things get out of control, some inflammation is part of the immune system, but when inflammation is out of control, like in rheumatoid arthritis, this will do damage to the body. Inflammation plays a major part in diseases such as heart disease, cancer, and obesity. Foods rich in trans fats and sugars stimulate swelling, redness, heat, and pain of the body. They induce overactivity of the immune system. Even saturated fats in this case, which are good for the body, be kept at the lower level. There have been no successful cures with drug medication for rheumatoid arthritis. Painkillers are often used to cope with the symptoms. Taking too many painkillers over a long time is creating many other serious health issues and be more deadly than the disease itself. For managing arthritis and joint pain, learn about the arthritis type affecting you to take control of your condition. Have a look at lifestyle and diet changes, also physical activities for pain relief, and natural supplements that can help. Foods that are anti-inflammatory. Whole grains are part of foods that are anti-inflammatory. Eating your grains, whole grains as compared to refined cereals, rice bread and pasta, helps in reducing inflammation. This is because whole grains possess a high fiber content. Being high in fibers helps lower the amount of C-reactive protein. C-reactive protein is a major cause of blood inflammation. Increase alkaline forming foods, such as fruits and vegetables, that can be included in a daily menu. A big boost of alkalinity can come by drinking a green juice daily, sourced from fruits, veggies, herbs, spinach, parsley, celery, beetroot tops, and wheatgrass. As many studies have shown, the necessary anti-inflammatory potential comes from omega-3 fatty acids. Having fish at least 3 to 4 servings per week, such as mackerel, salmon, sardines, and tuna, have a high content in omega-3 fatty acids. These fatty acids are one of the best ways in reducing inflammation. The fish be either boiled or baked as opposed to dried, fried, or salted fish. You should avoid foods with a high content of omega-6 fatty acids, such as fish oil supplements and processed vegetable oils, which can increase inflammation. Vegetable oil sounds healthy by name, but has nothing natural and best be avoided altogether. Soy. Non-processed soy products are part of foods that are anti-inflammatory. They contain estrogens and isoflavones compounds, which help your body in lowering inflammation levels. You should avoid soy that is heavily processed. This is because heavily processed nutrients in soy pair with preservatives and additives, which reduces the nutrients contained in natural soy. Beets. Beetroot and beetroot juice have vitamin C and plant pigments known as betalains that protect against cancer and reduce inflammation. It is also known that the nitrate content of beetroot juice is the key to lowering blood pressure, thereby cutting the risk of heart disease and stroke. Garlic and onions. Garlic works similarly to NSAID medications for pain. It shuts off pathways leading to inflammation. Onions have similar chemicals including allicin compounds that help in making free radical fighting acids. Garlic, we need it every day. It is useful in the prevention and treatment of heart disease and helps lower blood fats, cholesterol and blood pressure. There is also a key ingredient in garlic more powerful than the most two popular antibiotics at fighting one of the leading causes of food poisoning. Nuts are a good source of healthy fats, in particular almond nuts, which are rich in vitamin E and calcium, and walnuts, which are rich in alpha-linolenic acid. Nuts have many things, such as minerals, calcium, magnesium and potassium. Together with a low sodium intake, the minerals are crucial to bone health. Not only that, they also protect against arterial hypertension, insulin resistance and cardiovascular disease. There is no better alternative than foods that are anti-inflammatory. These foods ensure a healthy, disease-free life. If you are allergic to the foods mentioned, then it is advisable to avoid them, for they may cause increased inflammation.